Hi, I'm Natalie DePietro-Mager, and in this episode of Scripted for Her, I'm talking with Cami Dixon, who is a board-certified OBGYN practicing at The Ohio State University Wexner Medical Center. She also serves as an associate professor and as the medical director of Moms to Be, which is an innovative community-based pregnancy program for expectant moms at high risk for infant mortality. Her research is focused on racial and ethnic inequities in OBGYN care and in how social determinants influence pregnancy outcomes. Importantly, finding strategies to improve those outcomes. Last year, she was invited to share her expertise at Ohio's first Black Maternal Health Summit, which aimed to build a bipartisan movement across the state for health equity. So thank you so much for joining me here today.
Absolutely. Thanks for having me.
The Black Mamas Matter Alliance established Black Maternal Health Week 10 years ago to promote awareness and improve Black maternal health outcomes. This year, it runs April 11th through 17th, starting on the International Day for Maternal Health and Rights and falling within National Minority Health Month. This year's theme is Rooted in Justice and Joy. So let's start with the first part of the theme, which is justice. Can you please share the need for a campaign like Black Maternal Health Week?
Yeah, no, absolutely. And I think it's wild for me to think about this as now its 10th year, right?
Mhm. Yep.
There's absolutely still a need. And I think we start with the piece of the importance of the education of the outcomes that we're seeing. Unfortunately, if you think about this starting 10 years ago, right, and all this work that's been placed into trying to ameliorate the rates of Black maternal morbidity and mortality, and really making sure that Black birthing people have the same outcomes as any other birthing person. It is humbling to say the least. But I will say that forums like this are super important as far as continuing the message and making sure that we're all aware so we can all take care of all of our patients when we see them. There are still stark differences when we look at mortality and morbidity for Black birthing people compared to white birthing people, with the rates, depending on the cities that you're in, anywhere between 2 to 3 to sometimes 15 times higher for Black morbidity and mortality. And those numbers are really striking and definitely for a lot of my patients, really at times discouraging as you're preparing for your pregnancy, right? And this is where I think the justice piece comes in, right? Because we can't make moves, we can't improve anything if we don't know what's going on. Many of the programs that I've been involved in start with, at the very basic level, looking at the data, right? Do we have the data? Are we collecting the demographics of our birthing people? Do we know the outcomes? And then once we have those outcomes, can we really look and see what kind of changes can we make and what difference are we having here? So I think that piece is super important to reflect on.
Mhm.
I think the other piece that we try to really focus on it, and that comes into pieces in the sense that there's so many elements that come into play when we think about maternal morbidity and mortality. So many interplays between the systems that we have for our health systems, right? The health of our patients, the access to healthcare, even well before pregnancy. And I think that those pieces are super important as well.
Absolutely. It really is that preconception period that we've talked about on this podcast quite a bit that really, sets
Yeah.
up women's health for hopefully better pregnancy outcomes. And then, of course, the pregnancy and postpartum period. And I think it's also important to raise awareness that maternal morbidity and mortality is actually on the rise. So the
Mhm.
COVID-19 pandemic absolutely contributed to that. But independent of that, it's been on the rise. So unfortunately, that marker is just moving in the wrong direction.
Yeah, absolutely. And I think that that was probably a time in which we were able to kind of pause and look at our systems totally, right? I mean, this COVID was a time in which we were able to see some of our even social systems and how they were broken down and they contributed to increase, worse outcomes for patients.
Mhm.
If you don't have a hospital that's open, if you don't have transportation, if you don't have access to healthy food, these are all things that can contribute to poor outcomes. If you get to your hospital and you're not treated right, you're dismissed, people aren't hearing your symptoms or recognizing that you have a problem, that also contributes, unfortunately, to these poor outcomes.
It absolutely does. And, data show that it's about 80%, it's believed, of pregnancy-related deaths in the US are preventable, driven by the factors you've been mentioning, like systemic racism, lack of quality healthcare, those social determinants. So it really does just emphasize the need to be working toward health equity because these differences really are just unconscionable.
Yeah.
So, can you please share, what are some of the common medical risks that pharmacists should be aware of that are contributing to these high rates of morbidity and mortality?
Yeah, I mean, if we focus specifically on medical uh, causes, right? So things like cardiovascular disease is now the leading cause of mortality and morbidity in the pregnancy space. Previously, it used to be hemorrhage, right? So things like, people had a delivery, a lot of bleeding after, or had a surgery, a lot of bleeding. But now it's actually more cardiovascular. So things like high blood pressure, preeclampsia, stroke, heart disease. I mean, these are the things that are really contributing, unfortunately, at this place. Additionally, obesity does have an influence as well, and other, kind of background medical issues, whether you have, a history increasing your risk of blood clots or, kind of, I guess I already mentioned all the cardiovascular ones, but that is, still is just one little portion of it, and unfortunately isn't the total picture.
Mhm.
But I mean, I think as we're taking care of patients, absolutely, if you have someone who has a history of high blood pressure, like we're going to be watching them like a hawk, right? Because they are at increased risk for these bad outcomes, unfortunately.
Mm. I mean, absolutely. So the medical risks are important, but we have to realize those are in the context of the social risks. So thinking about the upstream, the downstream, there's a lot we should be doing more upstream to promote better health outcomes overall. What do you think are ways that pharmacists can really support women who are pregnant or postpartum? Where do you really see pharmacists as key partners in this care?
I mean, I think that's the piece. Like I've had the pleasure of working with really great pharmacists in my career and even in the outpatient space. I think I'm always really encouraged when I have a patient and there's maybe a conflict in medication or they mention something to the pharmacist and the pharmacist calls me, "Hey, your patient is here today. She's postpartum. She's trying to pick up her blood pressure medications, but she's concerned about X, Y, or Z." I think that that is amazing. So I think that the first step, of course, is interaction with the patient and understanding what is going on with them. Understanding that kind of making sure you're asking like, did you just recently have a baby or are you currently pregnant? I think that really does change things. And I've also seen it on the on the antepartum side as well, where it's a patient who's pregnant and there's a medication. Is this a safe medication for pregnancy? Is this something we should be considering? Is there an alternative option? So I think those pieces are super important. Additionally, when you think of even like the community pharmacist, that is another health touch point for a patient. So that's an opportunity when a patient needs resources to be able to have, hey, there's this program, there's this website, being able to direct patients to the education and support that they need, just so we can all work as a team.
Absolutely. I often talk about the community pharmacist playing just that key role in those clinical community linkages, really being that person that can, like you were saying, have that touch point with the patient and triage as appropriate or direct them to
That's correct.
resources in the community that they may need. So, you also mentioned really, I would say, like paying attention to our patients, and listening to them. And that makes me think of those urgent maternal warning signs and even that Still at Risk initiative from the Preeclampsia Foundation, encouraging women to wear those bracelets that would alert or, maybe have someone look at that bracelet and kind of realize like, hey, we might want to ask some follow-up questions here. What advice do you have around those urgent maternal warning signs, the recognition, and then kind of triaging or escalating as appropriate?
So I think that that is extremely important. I think in earlier studies, the statistic was close to 65%. When we look specifically just at the mortality piece, about 65% happens in that postpartum period of time. So like most of these catastrophic, really heartbreaking examples are in that period of time. And I think the biggest piece is that patients and sometimes healthcare providers don't recognize the risk in that postpartum period of time. So I think a lot of times people think, okay, cool, we had a baby, it was successful, I survived, I got out of the hospital, I'm doing great. But we still have to have that vigilance there in the postpartum period of time. And I think this is where the pharmacist can also, have a key in being like, how are you feeling? Are you having shortness of breath? Are you having swelling? Are you having a headache? A patient may tell you, well, I'm having bleeding, but I think it's normal. Is it normal? So these are the things that that I think is difficult, right? Because a postpartum period of time is it's just challenging in and of itself.
Mhm.
So many hormonal shifts. You're learning how to take care of your baby. You're recovering from from a vaginal delivery or a C-section. So it's just a wild period of time, but I think still making sure that you are alerting to the symptoms is super important, and making sure that patients know that, hey, this is what you look out for. This is what's important. And I think it goes even beyond the patient, but to their support people as well.
Mhm. Absolutely. So the caregivers of the caregivers, like supporting
Exactly.
partners and other family members, because as we know, women, I think, often maybe don't prioritize their own health, especially if they have a new baby to be taken care of. They might just be putting themselves last or kind of not always paying attention, kind of dismissing. And so that's where I think we need to be sure we're stepping up and really listening and following up with those important questions, like you mentioned.
Yeah.
Yeah, so I think those are all great examples of ways pharmacists can make an impact. And I do encourage listeners to check out our previous episodes of Scripted for Her. Our third episode really dived into urgent maternal warning signs and also postpartum care with an emphasis on mental health. And then our recent episode, just 2 months ago, episode 10, I believe it was, focused on preeclampsia. So if listeners want to learn more, I recommend tuning in and getting more details there. And so, before we go, what I really want to do is loop back to this year's theme, rooted in justice and joy. So we've talked about justice, and now I want to talk about joy because I want to be sure we're not overshadowing the positives by only focusing on the challenges.
I'm so glad you're doing that, because I think I've been involved in many different programs for Black Maternal Health Week over the years, and I think I try to always make a point of emphasizing that it is such an amazing thing to be able to do this. My son is 12. I feel so lucky that I was able to get pregnant and birth him safely, and that he's here, and just mothering him is just, it's so much fun. We play with Legos, we go to the park, like it's just every day is different. And I can't imagine what my life would be like without him in it. So when I have a patient who's like considering teetering, like, I just don't, I'm afraid of the risks. I'm a Black woman. You've seen the statistics. Should I do this? And it's a woman who wants to have children. I just emphasize that joy is so wonderful and important, that I'm here as your healthcare provider and partner to help you get through this rough part so you can see the joy.
Absolutely. So, again, hopefully we're working together as an interprofessional team to really help our patients have that good outcome. And like you said, really experience that joy of motherhood. So, another thing I know we've talked about before, you and I, is really that advocacy piece, right? So, both patient advocacy and then thinking about advocating in your workplace or even advocating for laws and regulations like your involvement with the Black Maternal Health Summit here in Ohio. So, can we talk a little bit about that? From the patient advocacy view, I know I mentioned earlier, patients might sometimes be dismissing their symptoms, but I think what's equally disturbing is that sometimes patients are speaking up and they're being dismissed. So, how can we be sure we are really listening to our patients, having that patient advocacy, or like you said, like listening to their family members as well?
Yeah, I mean, I think taking a pause to really kind of make sure that you're checking in with the patients, super important. I think it's so funny. Sometimes those of us who are practicing, you can kind of get into your rhythm, and you have just, you checking in. Okay, she looks good. We're all good. But you'd be surprised how many times I just take a minute and pause. And like, how are you feeling? Do you have any questions? Do you have any concerns? And just taking that minute to like, I'm not going to pause. I'm not going to say anything, and we're going to see how you're feeling and how you're doing. I think that piece is super important. And then I always, when I'm educating students that I work with or residents that I work with, like make a point, as when a patient comes to you in a healthcare setting. I mean, 9 times out of 10, like, I don't know about you, but like, I don't want to go to the doctor. I don't want to go to the hospital. Like, I don't want to be there, right? Like, let's be real. So, if a patient is in that space, they're there for a reason. They're not there because they have nothing better to do. They have a lot of better things to do, actually. So, you owe them that time to listen and find out what's really going on. And then finally, if they're having problems with a different provider, or if you hear, stories or whatever, it's important to encourage people that it's okay for you to find someone that works better with you. Like you can change. You're in that seat as the patient. So I think that those pieces are super important.
Exactly. And it's all about, like you said, the fit, I think, between the provider and the patient. And I think that's where, like, thinking about our workplace culture and kind of building the atmosphere that we want to have of treating our patients with respect and listening to them becomes really important. And then, are you aware of any initiatives right now at the state level or national level around the issue of either maternal mortality or infant mortality?
So, I mean, I know there are a lot of programs happening in Ohio right now, which is
Mhm.
really wonderful. There's been an emphasis on community-based programs. So here in Franklin County, so I'm the medical director of Moms to Be, which is our pregnancy and postpartum education and support program. So we do a lot of work advocating for our moms in our program. We work closely with another program called Dads to Be, which is a program for fathers, helping supporting pregnant people and the families. We've gotten funding from Celebrate One, which has done a lot of great work in Franklin County to decrease infant mortality and support pregnant people through their pregnancies to help make sure that people have healthy pregnancies. There's been some really wonderful work out of Cincinnati. Um, so, uh, um, Sorry, I'm like, why am I blanking?
I think, is it Cradle Cincinnati?
Well, sorry.
Is it Cradle Cincinnati?
Yeah. I don't know
Yep.
why I'm so sorry. But yeah, no, they've done like phenomenal work as far as really moving the needle once again on infant mortality, but also focusing on the birthing person.
Mhm.
And with that, uh, in Cleveland, there's Birthing Beautiful Communities. So anyway, a lot of community-based organizations throughout Ohio. The Ohio Perinatal Equality Collaborative, I'm one of the clinical leads for that. We're doing a lot of work as far as connecting hospitals with community and also addressing equitable care through a QI project. So, we've been working on that. Outside of that, I mean, some of the things that have come through over the years that have really been helpful, even just the expansion of Medicaid is like a game changer. Because as we said, many of those things happen many of these poor outcomes happen in the postpartum period of time. And I remember a time when I practiced in a place that did not expand Medicaid and having that rush to try and get everything done for a patient by, 6 weeks postpartum or 8 weeks postpartum before they lose all coverage. And it is heartbreaking trying to get people in to do the things they need in that short period of time, neglecting the fact that maybe something will pop up 2 or 3 months later, right? So I think that was probably a really great example of a huge advocacy effort that was successful.
Absolutely. It just really shows that interplay around health policy and honestly how often health policy decisions like that really do impact women disproportionately, has a lot of impacts for women. And I know that's a lot of the concerns being expressed right now with some of the proposed changes to the Medicaid program moving forward. That has been such an important lifeline for so many patients.
Yeah.
Yeah. Well, this was really great. Thank you so much for talking with me about the importance of Black Maternal Health Week and ways that pharmacists can make a difference. Also, thinking about all those wonderful community partnerships out there that we could really be tapping into and collaborating with. So, we will have posted to the Drug Topics website below this podcast a link to the Black Mamas Matter Alliance toolkit for Black Maternal Health Week, which has a lot of great, important information. It also has a lot of social media posts or things to get you started if you want to really promote this more within your practice and within your network. So again, thank you so much for your time here today. Appreciate it.
Thank you so much for having me.